Okay, so today we're here for the training for the knee case of the Health Science 201 SP event on the 7th. Um, any questions? Anybody have anything that they need to get off their chest now before Micah starts?
The event the event is on Wednesday the 12th.
Oh, sorry, the 12th. I had the training.
Yeah, you
So read
misspoke
it
there. I
down.
just want to clarify.
I'm Ron Burgundy.
The 12th of never.
All right, so if there's no questions, Micah, you have the comment.
All right. Hi folks. Thank you for being here. I'd like to share my screen so I can go through this knee pain case with you all that I've made. So, first of all, I just want to thank you guys for doing this. My students, they're undergrad students, and most simulation experiences like this with patient actors are only offered to students who are in graduate school. These students want to go into some kind of health related graduate program, but they're getting this early on, and I quarter after quarter, semester after semester, hear back from students that have gone to grad school and they say how helpful these experiences were and are for them in their future careers. So I just want to let you know it really helps out.
Thank you.
And sure. And the they are undergrads, so this is their first time. Well, this is their second time doing this, but they're newbies at this. So uh, be gentle with them. Um, just keep that in mind. Their jobs, uh, my job for them is to help develop their interpersonal skills in a professional kind of setting like this. And I talk about things they should say or shouldn't say, and I talk about how they should or shouldn't say them, and they learn that, but then there's actually doing it, and that's where you patient actors can really help me, which is sitting on the patient side of things and really just getting a sense of how it felt to converse with them. Did you feel comfortable with them as like a provider? Were they respectful? Were they polite? And these are things that I can't tell if they're actually happening. It has to kind of be seen and felt. So, what it feels like to be their patient is like the big thing to do here that I'm asking you to do. So the case itself, if you can see my shared screen, I'll run through the background of the case and the details of it. So what to wear, they will need to access your arm for blood pressure taking, and they will be doing a targeted exam of your knee. So you should be able to don't wear something tight that could interfere with blood pressure taking on the top, and don't wear something tight on the bottom that can interfere with them doing a targeted exam on your knee. The mask requirement is no longer there, so you can just ignore the mask part of it. And I told you these are undergraduate students. The overall purpose, the most important part in my mind is developing their interpersonal skills, particularly in a professional setting like this. So what that looks like, the students should be asking a lot of open-ended questions. What brings you in today? Tell me more about that pain that you are describing. Can you tell me a little bit about your family history? They're not yes no questions. They're broad questions, and the whole idea is to get you, the patient, talking and then them listening. So they should start the interview, they should start each section with open-ended questions to get the conversation going. And then they can and they will narrow down their questioning. So what brings you in today? Okay, it's pain. Tell me more about that pain. It's a little bit more targeted. Okay. And then they can at the end do the yes no questions. Did your pain have a fever with it? Yes or no. Did your pain have this with it? Yes or no. And then they'll start back over in the new section with an open-ended question. So a lot of it is open-ended questions that they ask you, and then them giving you some space to talk about it. And and I want you to take note of how they listen. Do you feel like they're listening to you when you're talking? Are they giving you decent eye contact? Are they just typing notes during it, or are they kind of nodding their head at appropriate times? I'm sorry, are they mirroring your facial expression? So if it's a part where you are very sad and you're showing sadness, you're emoting sadness, they have been trained to mirror your emotions. So they should kind of show that they are also sad too, or they recognize this sadness and they're showing it in their facial expressions and other nonverbal cues. So those are a part of active listening, which is a key part of interpersonal skills, and open-ended questions is another aspect of that. Now, with all this going on, the students, in addition, have to organize their thoughts and the way that they ask these questions and manage the pretty short time period in which they're asked to do this. So that's the other element, organization and time management. For you as the patient actor, I think the organization part could be something you might be able to pick up on. Like at the end, you say, "Well, you were really like disorganized in this section." Maybe that's where you can make improvements on. But the majority of that time management stuff is going to be them reflecting on the experience and then seeing where they can streamline things. Okay, so the scenario, you're in a primary care doctor's office, outpatient clinic, and the student is acting in the capacity in the role of a medical assistant. That's kind of what they're being trained to do here. In a sense, this is like teaching them to be a medical assistant, but it's not. There's more to it, but they will identify themselves as a health science student, so that means they're not playing anybody other than themselves. They'll do a complete medical history, which asks you about your chief concern, why you're there, a history of that particular issue, which is a knee pain, your past medical history, family, and social histories, those different sections. Then that completes the interview, and at that time, they will take your blood pressure and heart rate. And if they have time at the end there, they'll do a targeted exam of your knee. So they'll palpate your knee, touch your knee, and they'll ask you to flex and extend your knee, and then they will ask you to resist movement. If they push on your leg, don't let me flex your knee, don't let me extend your knee. It's 20 minutes for the whole encounter, and then it's 10 minutes of your valuable feedback. And when you give that feedback, it's very, very helpful if you can give specific examples from the encounter. So if your feedback is it'd be if your feedback is they should be giving you more, let's see. If the feedback is that you felt uncomfortable when they were asking sensitive questions. It's even more helpful when you say specifically what they were asking about. You know, they were asking about your sexual history and specifically what about it that they did or didn't do made you feel uncomfortable. So the more specific, the better. The more specific, the better. But you also, kind of give it just felt like this. This is just the way I felt, and that's okay too. To the case. The patient that you're portraying is there because of knee pain in the right knee, and it's been getting worse over the previous 3 months. Your name is either Pat or Patty Klein, and date of birth 1/1/71. But if you need to adjust this date of birth to make it more realistic, that's okay. The age of the patient here is not relevant to the case. So 1/1/71, but if you need to adjust it, that's fine. So the student will knock on the door, ask to come in. You come in, and they're they should go straight to you and introduce themselves before doing anything else. They should go right to you, look you in the eyes, shake your hand, and say they identify themselves. And I'm a health science student here, and I'm going to be doing this, this, and that. I'd like to just confirm your identity. So the door sign will have your name and date of birth on it. So they should say you're Pat Klein and you were born on 1/1/71. Is that right? Okay. Then they'll sit down most likely, and they should give you a an agenda. So instead of just jumping right into it, what brings you in today, they should say, "Well, I want to ask why you're here today, but I also need to know about your past medical history, your family history, and social history, so that I can get the full picture and help you out in the best way that I can. Is that okay with you?" So that's a theme that will come up where they kind of summarize what's coming, kind of keeping you in the know and teaming up with you, developing rapport with you as the patient, and then asking for permission to move on, making sure it's okay with you. Is that okay if we proceed? And you say yes. So they'll say an open-ended question, what brings you in? What brings you in today? So here's your response, which is that you're in because of your right knee. It's been hurting and it's been getting worse over the last 3 months. You've noticed some swelling, and it's a problem now because it sometimes is so painful it keeps you up at night. You have trouble falling asleep 2 to 3 days a week. You remember it starting about 3 months ago, and the timeline there lines up with a new exercise workout regimen class that you joined at that time. So this is why you have the knee pain, basically. You suspect it as the patient, but it started right when you started this new workout regimen. And it's been getting worse since then, and you've continued to do the workout regimen. So you're concerned about it because it's affecting your life now. You're staying not sleeping well, and you wanted to come in to have it checked to make sure that it's not anything more than just a bum knee kind of thing. So now the follow-up questions that the student will have, they'll ask you to maybe say more about it. And when they ask you to say more about it, can you tell me a little bit more about what you've experiencing? You have stiffness the morning after the workout, the workouts that you do. So stiffness in the morning. It's only your right knee. You don't have any associated symptoms, and they'll ask, like, do you have fever or fatigue or nausea, vomiting? You say, no, 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 none to those. No numbness or weakness in that leg, and you haven't experienced any buckling of the joint where you like take a step and you put weight on it and then it just gives. Now, the workout routine is the thing that the student should pick up on, and if they do, a good student here will ask about it. And if they ask about your workout routine, here it is. It's a local gym class that's twice a week. It's a CrossFit kind of deal, and what I mean by that is it's a mix of cardio, running kind of stuff, running stairs, running around, the running laps, that sort of thing. So aerobic exercise, and it combines with it the weightlifting and aerobic kind of exercise as well, lifting weights like squats. And I've highlighted this running stairs and lifting weights like squats because these are both activities that put a lot of stress on your knees, and these are the main activities that you have noticed that makes your pain and stiffness the worst. When I run upstairs, when I'm running up and down the stairs, or when I'm doing squats, that makes my knee hurt the worst. You have been diligent about going to your workout regimen, so you've been going consistently for the past 3 months, but the pain in your knee has only really gotten worse. So now the follow-up questions, they want to know about the pain you're experiencing and then all of the different elements of that particular pain. So where it's happening, what it feels like, and if there's other stuff related to it. So the student should ask these. It may not be in this order, but they'll ask most or all of these questions. So location, where does it hurt? So I want you to point to your kneecap and say, underneath my kneecap. If it feels like it's deep to my kneecap. If the student asks about uh, movement of the pain, or if the pain travels, another term is radiating pain, you say no, deny this. The pain stays in that location. It's not like starting in the knee and shooting down, or starting in the knee and shooting up. It's localized to that one spot. When did it start? 3 months ago, and it's in line with when you started that workout regimen. If the student asks you if you think it's related, you say yes. You do. You kind of assume that that was the cause of it. If you get this question, and you'd only answer these questions here if they're asked. So the student has to ask this, have you experienced this before? And it turns out you have. You said you had this about 10 years ago, same knee. You didn't see anybody, a doctor or anybody about it, because it ended up going away on its own after you stopped exercising regularly. So you rested and it went away, and you haven't really had a problem with it since. When do you have the pain? You feel it during the workout routines, but especially in the evening, night, and the next morning of the days that you have the workout routines. It sometimes wakes you up, and you would say it's like 1 or 2 times a week that you're now woken up with the pain, which is kind of a red flag when it comes to pain. All right, when is it uh better? When is it worse? So do you know when during the day, or anything, what makes it worse kind of thing? And so here's where you say, all right, you notice that it's worse when you are after you do the running up and down the stairs, and performing the squats. They're very knee heavy uh, exercises that can give this kind of pain. You also want to say that you've noticed, and in the past, you will try to get aisle seats when you're like flying on a plane, or if you go to a movie, you'll sit on the aisle. Or if you're in like an office chair, you're always trying to put yourself in a sitting position where your leg is straight, your right knee. Keeping your right knee straight helps. In this, the case I've made here, the common term for this kind of knee issue is called moviegoer's knee, where people with it, including myself, if I go on an airplane, I'm sitting in the aisle so I can extend my left knee into that aisle because it hurts if my leg is flexed for a long period of time. So that's what you kind of say. I do find that the pain is relieved if I extend my leg straight for a period of time, and it gets worse if I keep it flexed. So moviegoer's knee. All right, so more elements of the pain. Can you describe the pain in a little bit more detail? Can you describe it? And this is where you can kind of play dumb here. I'd like you to, where you say I don't really understand what you mean. What do you mean describe the pain for you? Like can you be more specific? And then the student at that point should offer you prompts and give you examples of what they mean. So they'll say, so is the knee like a pins and needles like pain? Is it a feel like it's on fire? Is it sharp? Is it burning? Is it throbby? And then you say, oh, okay. All right. It's an achy pain, but it is also throbs at times, and it feels it's persistent. Like it's persistent, so it just is kind of always there, like a toothache. So that's the quality of the pain. Now, the quantifying the pain on a scale of, I'm sorry, what they'll say is they'll say uh, on a scale of 0 to 10, what level of pain would you say you're currently having? And uh, here they should describe the anchor points. And what I mean by that is they should say on a scale of 0 to 10, 0 being no pain at all, and 10 being the worst pain you've ever experienced, what would you say your pain is currently? And so at that time, if they ask current, you say 2 out of 10. You're feeling pretty good today. Only if they ask about what it is at its worst and its best, then at its very worst, like the morning after running upstairs, it's like a 7 out of 10, which is bad pain. And then at its best, it does disappear, which is also good to know, which means it's treatable, at least the pain part of it, not necessarily the root cause of it. So 0 out of 10 at its best. And that's when you rest. That helps the pain get better. You ice it, which helps the pain get better. And with rest, ice, and Tylenol all together, and a couple of days after your last regimen, you can get that pain down to a 0 out of 10. But with just Tylenol, it'll bring it down to like a 2, like you currently have. What makes it worse? We know that it's probably this running stairs, doing squats, and sitting with legs flexed for extended periods of time. We know this. Uh, associated symptoms. Associated symptoms. So it sometimes does swell up, and you also feel and hear a crackling kind of sound in both of your knee joints when you're running up the stairs and in particular on uneven surfaces. It's not a painful cracking, but you did start to notice it when you started this routine 3 months ago. And your joint does not get red or get hot to touch. So it's not like an infected joint, is basically what that's saying. And is it affecting your sleep? If they ask, yes, you probably will have already talked about it. You wake up 2 or 3 times a week with it. You can't fall asleep 1 or 2 times a week with it, and it's starting to really interrupt your life. So for the pain, in addition to rest and extending your leg, you ice it and you take that Tylenol, which is acetaminophen. And finally, only if they ask you, but if the student says, "Well, what do you think it is?" Then you say, "Well, I think it's from the workout routine," and you suspect it's some kind of injury, overuse injury, where you just pushed it too hard and caused some kind of damage in your knee. And you're worried, you're concerned because you think it could possibly be something worse than that, like a fully damaged ligament or something more than would just be able to kind of heal on its own with time and rest. So you're concerned it's like a cartilage damage or damaged ligament or something bad that has to be uh, treated, maybe surgically, and that's like a big reason why you're in the clinic today. Okay, so that's a big part of it there. That's a big part of the case there. There's the the knee and then all the elements of the pain with the knee. Now the student should kind of briefly summarize. I asked about your knee. You said it was 7 out of 10 pain and it was a throbby, achy pain and it goes away with rest and this. And they kind of summarize the key points and they'll redirect you and say, well, now I'd like to get more information about your past medical history because that can be relevant and that's helpful to have a bigger picture. Is that okay with you? So they've summarized, they redirected you, and then they asked you for permission to move on. And now they move to the next section and they start with open-ended questions. So, do you have any health problems that you're aware of? And you say, yes, I have type 2 diabetes and high blood pressure. When they follow up about those, it's last 10 years of high blood pressure and it's well controlled with adherence to medication. There's a medicine you take for it, and you regularly self-check your blood pressure at home and at the pharmacy. For the diabetes, it was more recent. That's 5 years ago, and you thought you had it under good control until about 2 years ago, when you started putting on weight at that time, and that's when your diabetes got worse 2 years ago. So the medicines that you're now taking for the high blood pressure here, it's amlodipine. So it's the name, the dose, 10 milligrams, and then the frequency once a day. So amlodipine, 10 milligrams once a day. For the for the diabetes, you take this pill, metformin, 500 milligrams twice a day. So there's the name, the dose, and then the frequency. Any other non-prescription medicines? If they ask, you say you do take a fish oil supplement for your heart, and then it's just that Tylenol acetaminophen for your joint pain and the occasional headaches, but no other non-prescription medications that you're taking. So for the female patient actors, the student may ask about a quick uh OBGYN uh history, and this is a cursory history of it. So they're gonna ask you how many times you've been pregnant, how many times that you have how many children do you have? And then they will ask when you started menstruating and whether you are postmenopausal or perimenopausal or not. And this information is not relevant to the case, so I would just keep it real simple, like one pregnancy, one child, and then you started at age 13 and you either are continuing to have regular 28-day cycles or you are now postmenopausal and that happened at age 58. Something like that. Like nothing crazy, I guess. And use your own if you feel comfortable, if that makes it easier to kind of remember. But that should be a pretty cursory asking by the student. Mental health history. So here, if they ask about it, you say no, and then the student may prompt and give you like, do you have uh, a, a common psychiatric disease, the three most common depression, anxiety, or bipolar disorder. So they may ask, like, do you have any of these, or do you know if any runs in your family? And you say no. The surgical history. So there's one mistake that I made. I have to make the correction here. So this should be 10 years ago. So 10 years ago, you had arthritis, cartilage damage in your right hip, and you had that replaced. You had a right hip replacement 10 years ago. For childhood problems, you do remember being overweight as a child, but no other serious medical issues that you can remember. Okay. Okay, so now they'll do a quick summary. And then say, well, I'd like to ask about your family history because some diseases can run in families. Is that okay with you? And now they'll start to ask about your relatives, and they'll start with your parents, and then ask about your grandparents. The goal for them here is to get three generations of answers. Three generations. So when they ask about your father, they'll say, "Is he alive? And is he well?" kind of thing. And your dad is alive. He has high blood pressure, and he's well as far as you know. Your mom died at age 70, and you know that she had diabetes. This one, oh, that's right. You have one daughter. So you do have one child in this case, and your child can be age 20 or older or younger to line up with what your age is. So what makes the most sense? The key thing is that there's no known ailments for her, for your child. So that actually gets the three generations for the student. You got the child, you got the patient, and then the parents. Now, it may come up in this section, the family history part, but it may come up in a different section. So whenever it comes up, if it does come up, you had a recent death of your sister that was complications from, they think, a COVID related illness. And it was very unexpected and it was sudden, and you're really upset about it. and you're really upset. It was a very unexpected. You were very close to them. So you're basically mourning this person, grieving this person's loss. And um this is the part where the student should like stop what they're doing and put down the pencil and kind of turn and look and give you like full attention and empathize with you and listen to you and express sorrow uh, with you and kind of see you through this part of the interview. So it's a challenge for the student, so I'd like you to take note of how they respond when you get to this part. When you get to this part, I have taught them like I've given them the building blocks to how to what to do, but now it's like on to them to actually go through and do it. And this is part of their learning process here. They got a little of it the last 5 weeks ago or so, and they'll get some more of it now. And it's a big important part of medicine to be able to empathize. So take note of what they do, what you think they did well, what didn't go so well, and if you felt comfortable and that's that. So it'll be a couple of minutes maybe out of the interview time, and then don't belabor it. Don't let it drag on for much longer than that. Don't make it hard for the student to kind of move on to the next section. All right. They'll say these are the summary points of family history. Now I'd like to do social history, and here's where the sensitive questions can come. And what I've instructed them to do is to tell you up front that there are sensitive questions coming, so giving you a warning shot, and to tell you that you don't have to answer any of these if you don't want to. And if you don't feel comfortable right now answering any of these, to tell me, to tell the student, and then they'll move on. And they should preface it like that. Uh, and that's how I've instructed them to do it. So the social history, they'll ask about your work, they'll ask about your hobbies, and then your home life, and then we get to diet and exercise stuff. So for the work stuff, you say you work for HR at Drexel, and it's remote work. That's germane to the case because you're sitting in an office chair. You're sitting in the office chair. And that's relevant for two reasons. One is because now you're sitting in a chair and you can't always keep your leg extended. So it hurts. And so it's starting to interfere with your ability to do your job. And the second is it's a sedentary job. So that may be part of the reason why 2 years ago your diabetes started getting worse because you became more obese, less activity, that sort of thing. So it is important here what your occupation is, which is an HR person that works remotely. And you are working currently. And if they ask, like, are you worried this is going to affect your ability to do your job? And you say, well, yes, I have to sit for long periods of time and I'm not always able to keep my leg extended and it hurts. And it's hard for me to focus sometimes on doing what I have to do. Then they'll inquire about your hobbies and recreational fun, and the key thing here is that it's sedentary stuff that you do. Coin collecting, maybe bird watching. I guess that's not a sedentary activity for sure. But it's not like aerobic exercise, it's still moving around. So the things you do are more on like the sedentary side of things. That's what I was trying to get at here. And then your living arrangement is also an important thing to consider that they ask about because of the fact that it's a two-story walk up that you live in. There's no elevator. which means you got to walk stairs to go up and down. And if your knee is hurting you, that's a problem to get in and out of your house. So you're in a two-story walk-up and you're living in or around Philadelphia, uh, and you work from home. Diet and exercise. So the exercise part I'll do first. They'll say, "What's your exercise like?" And here's how I'd like you to talk about it. So say like I used to exercise, but 2 years ago, when I got this current job that I have, it's a desk job now. That's when I stopped exercising. And if you recall, that was also when your diabetes started getting worse. So there's a link there. You notice that your diabetes has been getting worse, that you've been increasing in weight, and so to try to combat this, you signed up for that class, that workout regimen class at a local gym 3 months ago. And it's intense. It's twice a week. It's intense. It's 2 hours per session. So that's 4 hours per week. And this is moderate to high intensity interval training. It's not bird watching, I would say is mild. There is aerobic movement going on there, but it's not sustained elevated heart rate. This is a moderate to even high, like really pushing the limit kind of training, which is aerobic and anaerobic. And what I want you to do here is to ask the student if you think you're doing enough. Am I exercising enough? I'm doing 4 hours a week, and I'm trying to get my A1C down. I'm trying to improve my diabetes and my weight. Do you think I'm doing enough? And the they have been the answer would be yes. It's okay if they say yes because 150 minutes per week is the recommendation, and you're well above that. The caveat to it though is like when you get above 150 minutes per week, the there's diminishing returns on your heart health, and there's increasingly more and more wear and tear that occurs on your joints. So that's where they arrived at that 150 minutes per week number. So if you were asking me this and I was in the clinic, my answer would actually be it's too much. You're exercising too much. But I want you to just challenge the student there. And I don't think they can really answer incorrectly here because it's a complex situation. But they could say this is enough. They could say this is like too much, and they should cite that 150-minute per week rule. I think the only wrong answer would be that you're not exercising enough. But they could answer any three of those ways, and it's not so much about how what they answer, it's about how they do it and how it makes you feel. So challenge them there. Challenge them there. Some could argue this is too much, and it seems like it is too much because of what's happening with your knee. But it's it's a good amount. It's good that you're doing it. I think it'll be hard for them to like discourage you from trying to better yourself uh, when it's a good thing that you were trying to improve your health. So, all right. So to the diet, you eat mainly frozen prepared meals and you order in delivery. You try your best not to add salt to meals, and only if they ask you directly, what did you have for breakfast, lunch, and dinner yesterday? So it was black coffee, orange juice, and eggs, some kind of deli sandwich with cheese for lunch, and then four slices, half of a frozen pizza for dinner. stressors in your life. If it hasn't come up already, they'll ask what's like the biggest stressor going on in your life or stressors, and it's undoubtedly the recent passing of your sister. So if it didn't come up in the family history, then it hopefully will come up in the social history, and this is where you share your terrible recent loss and uh, kind of mention it and see how the student response. All right, we're getting towards the end of this training. This is the social history part. Now, tobacco, drinking, and drugs. So, do you use tobacco? And you say, no, not currently. If they ask, have you ever smoked tobacco? Well, you say, okay, well, yes, I did smoke cigarettes, but I quit 3 years ago, which is like probably another reason why your weight went up at that time. And then only then if they also ask for how long before that did you quit, you say 10 years at about a pack a day. A pack a day, because the risk that's given to you when you smoke cigarettes doesn't leave you. So what the student is doing here is risk stratifying you. Okay, the drugs. So you don't use drugs, but did you ever use drugs? Well, you say, well, I did. I was addicted to the pain pills that they gave me when I had my surgery for my hip 10 years ago. Vicodin pills, which are type of opiate. Uh, that was 10 years ago you had that surgery and you were hooked on them for 2 years until you went to rehab and you haven't used any since. Now to the alcohol part. So you the patient does have an alcohol issue. So when the student asks your alcohol intake, you say, I want you to say this. I want you to say on like 2 or more nights per week, you'll have more than 5 drinks in one sitting after work. You're not happy with this amount, you know it's too much, and you think it's contributed to your weight. So that number, the numbers that you gave are important there, especially this 5 or more drinks in one sitting. The students have been trained to pick up certain numbers of drinks per day or per week. And if you are over that, it should trigger them into asking these 4 questions down here. So 2 or more nights per week, you have 5 or more, you binge drink basically. You have 5 or more drinks in one sitting. That alone, whether you're male or female, should trigger the student into asking the 4 cage questions. And the cage questions go like this. Have you ever felt like you should cut down on your drinking? Have you ever been annoyed by people criticizing you for drinking? Have you ever felt bad or guilty about your drinking? And have you ever had a drink first thing in the morning to steady your nerves, or an eye opener, as they call it, CAGE, the cage questions. So if the student asks you the cage questions, I want you to answer yes to at least 2 of them. It could be 2 of them, 3 of them, or all 4. But it should be at least 2 of them, because 2 or more questions on this questionnaire answered yes means that the person's at high risk for alcohol abuse, and then it usually triggers like more follow-up care. So 2 or more yes for the cage questions, and the cage questions should be given to you like right after you tell them what your drinking schedule looks like. Has your drinking never been a problem in your life? and you say, "Yep, my daughter is not happy with me for drinking. We've had fights over it. It hasn't impacted your work, but you certainly wonder about the impact that it's having on your health." And then have you ever blacked out from drinking? And you say, yeah, I have maybe 10 times in the last 2 years. So a lot. Okay, so that's the end of the social history. So now the student should give you a brief summary of the key takeaways from the social history and then summarize the whole interview, just hit on the most pertinent parts of the interview and then tell you what's going to come next. And they'll at this point they're actually going to take your vital signs and then examine your knee. So they should tell you that. And after they do those two, if they have time for it, they would say something like, "I'm gonna now take all this information and bring it to the doctor, and we'll come back in and give you our plan. Do you have any questions for me now?" It's kind of keeping you aware of what's happened, what's going to happen, and continually check in with you to make sure you're okay with it so that you've got a good team kind of feeling about it. So the feedback, at that point, the 20-minute mark goes off, and now you've got 10 minutes to give feedback. And this is mostly going to be how it felt like to be their patient. And that's um, a lot of it is interpersonal interaction, mix of friendliness and professionalism. Was there a little bit of kind of outside conversation stuff, teacher talk or doctor talk, as they call it, that helped to humanize them? Uh, and do you feel like you guys were on a team? Was there good rapport that was developed? And with that, a huge part of that ends up being the active listening skills and the nonverbal cues that they are giving. So uh, take note of eye contact, take note of their body positioning. Were they sitting straight, looking straight at you with their computer to the side, and they were leaning forward and engaged with the conversation? Or did their body language suggest otherwise, where they were turned, looking the other way, closed up, legs crossed, that sort of thing? And you may not be able to like quite pick out what was it that made it feel like they weren't open or not. But that's okay if you can't like you just say like it just felt like you weren't very engaged with me, and then the student can look back at the video and figure out why. Some other things to take note of when considering the feedback. So, did the student ask about your perspective as the patient, which is like asking you, is it affecting your life? Asking you what you think the problem is? Did they ask these questions about your perspective? Did they get to the cage questionnaire, which I think most will? And then for the verbal communication uh, stuff to take note of, were you listened to? Do you feel like you were given time to talk, especially after a student gave you an open-ended question and they didn't interrupt you? Did they start each section with an open-ended question? Did they use understandable language, non-medical layman person kind of understandable information? Did the student check in with you after each section, make sure that you were okay with moving on, and if you had more questions? And then stacked or leading questions, these are always in there. So a stacked question is one, do you smoke, do drugs, or drink alcohol? They go bam, bam, bam. They ask you all in one sentence. And that's not good form to do that, even though it's done all the time to save time. They should ask you one at a time because it makes it easy for you to just say no, blanket no to all of it. or a leading question like, you don't do intravenous drugs, do you? It makes it hard for them to say, well, actually, yes, I do. It makes it a lot easier just for them to say no and to move on. And then the transitions between the sections, if you could kind of take note of how they go about doing that. It should be like a brief summary of the key points of what you just talked about, and then a brief preview of what's to come, and then saying, does that sound good to you? Is that all right? Are we okay with moving on, and teaming up with you, making sure everything's accurate to that point and they're ready to move to the next section. So those are some of the more specific kind of considerations for the feedback, but the format of giving the feedback is essentially, it's essentially like this. You say, student, what do you think went well? And then you tell them what you think went well with as specific as you can remember. Say, I feel like you did really good when you said this, and I felt very heard when you sat like this. The more specific, the better, but sometimes you may not have specifics, and that's for the student to watch the video back on. So what do you think went well, student? These are the things that I think went well. And then you say, well, what do you think didn't go well? And they'll tell you. And then here's where you can remember maybe like two or three major areas uh from the session. If you have like two or three like good examples of areas that didn't go great and they're specific examples, then that would be really helpful, that the student can really like focus in on those areas. And then um, some suggestions of what you think they could do that could better help next time. But those suggestions, most of that ends up coming from me and from their own reflections on the experience. So don't feel like you have all the answers here. Your job is to tell us how it felt like to be their patient, and to be as specific as you can as to when you felt that way. And then ask if the student has questions, and then that'll be it. That'll be it. They're not going to be perfect at this, but they usually do better, have some more confidence the second time around, and they're looking forward to this experience. And I know they're grateful for your work here, so I appreciate it. And I see there's a couple of messages. Somebody's out. Okay, somebody had to leave. So now I'm finished with my training. So I wanted to see if there were any questions about what I've discussed here first, right off the bat.
Hi, Micah. This is Kathy. Just wanted to double check on the smoking question. It says just say no, but when you were mentioning, I'm not trying to be like real picky about it, but you said just say no, not at the moment. So would that tip them off? Do you want us to just say no, or like tip them off to ask the other question and follow up?
You could say not at the moment. I think
Okay.
I'd be okay with that. Not at the moment
Okay.
kind of thing. That's not giving too much of a hint, I think. Uh,
Okay.
yeah, I think that would be appropriate.
All right. Thank you.
Hmm. So I'm available by email. So any questions that might arise, and those who are watching this video later, feel free to reach out to me. And then,
Doctor, quick question. Can I ask a quick
yeah,
question?
sure.
Are we allowed to wear a hospital gown if we want, just for if we want to do it? Is that okay?
You sure can. Yeah,
Okay.
you
Okay.
sure
Thank
can.
you.
Yeah, the
Thanks.
hospital gown would be absolutely okay.
Okay. Thanks.
Hmm.
More
Alrighty.
questions? All right. Well, folks, make sure you put your hour in, and we will see you Wednesday.
Okay. Thank you.
All
See you
right,
next
Quentin.
Wednesday.
Thanks, everybody.
Bye-bye.
Take care.
All
Bye
right,
bye.
Bye
Quentin.
bye. Have a
Bye.
good
Bye bye.
Bye,
weekend.
Doc.